If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today. As you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. Now, it's more important than ever to become an informed patient, and we are here to bring you timely health discussions. For those who are new to the show, there are two ways to get your questions in. First, you can call our live phone line at 718-499-6101. And second, and I've been getting a lot of these during the break, email us your questions to askthedoctor@netny.net, and we're going to bring them into tonight's discussion. Now, we've never had the chance to answer all your email questions. Now, for this episode, we have Dr. Kanchmala Katapati. She's an internal medicine attending at the New York Methodist Hospital. Dr. Alexander Shaknovich. He's a cardiology attending at the New York Methodist Hospital. And Dr. Montgomery Douglas, and he's the chair of the Department of Family and Community Medicine at New York Medical College. And welcome to all of you. Now, in the news this week, we're going to deviate from usual because it was a sad week for me and for many people in the community. My father, Dr. Harvey Garner, who was the former city school chancellor, passed away. And it was sad, but we learned a lot about his life by the hundreds of people who came up to tell me of ways that he helped them that we never even knew about. PTA presidents, students, teachers, and it was really amazing. And I want to thank everybody from NET, from the tablet, from the whole community for the kind words and support. It's something that was very sad, but he had a very good life and left a lot behind that we're going to for things to be positive. He was an assistant principal at PS 58, which is not far from in Brooklyn. PS 298, he was principal, and then for 25 years he was the district superintendent in Canarsie, East Flatbush, until he was called to be the school's chancellor. And he had to deal with asbestos crisis, teacher contracts, and so on. And somebody who really came up through the ranks. A lot of times you don't see that today. You know, people don't always have that experience. So once again, I'm really grateful. I want to thank Monsignor Bennett, who's here with us once again tonight, for saying a prayer intention for my father, and for all those out there who said prayers or expressed well wishes. I thank you, and my whole family does. So what I thought we'd do now is take a short break. And when we come back, we're going to go to your questions. So the topics, remember, are internal medicine, cardiology, and family medicine. The number to call is 718-499-6101. Now remember, you can also email us your questions at askthedoctor@netny.net. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor, where our topics are internal medicine, cardiology, and family medicine. Now, let's meet the crew that we have here tonight. It's a great staff of doctors. We have Dr. Kanchmala Katapati, internal medicine attending, Dr. Alexander Shaknovich, cardiology attending, and Dr. Montgomery Douglas, chair of the Department of Family Medicine and Community Medicine. Let's just throw in the quiz first, because we have this all-important quiz that I know people are waiting for. Now, we've all heard of Red Hook, Brooklyn, right? That's a tough area, pretty tough area. You've got to go in there, you've got to be ready to defend yourself, I think. But it's a good area. Now, there's another section of Brooklyn called Yellow Hook. Now, was that? Wonder why it got the name Yellow, right? It wasn't because the people, were they yellow, or was it, what was it? So the question is this town of Yellow Hook changed its name shortly after it was named Yellow Hook for a particular reason. What was the name of this community or town? And why was the name changed? You've got to get both to get the prize. So again, the town that was called Yellow Hook, what is its current name, and why was the name changed? Okay, now let's go to Dr. Katapati. How are you? Welcome back.
Very good.
It's been a while.
Thank you. Yes.
And what's been going on? What's new either in internal medicine or at home with the Katapatis or what?
At home, there's always exciting things with 3 kids. I have my second one getting ready for high school.
Wow.
You know, she took all the tests, yeah. So she's waiting for her results. As far as internal medicine, there's a lot of exciting things. There's some new treatment for atrial fibrillation, new recommendations for adult immunizations.
So we're going to get to all that. You get your questions lined up. You got to, what vaccine should you be getting, right?
Yes.
And we had so many. It seems like there's an epidemic of atrial fibrillation. It seems like every show we get 4 and 5 calls. So we'll be get your calls, get your fingers ready to dial here. Don't get too excited. I don't want them to start fibrillating here. Now, Dr. Shaknovich, always a pleasure to see you. I love when you're on the show. We always get, you're going to see, you get medical information as well as life philosophy, which is, I always love that thing because you go home feeling better than when you, at least I do. I always feel better after you're on. So.
Well, I'm not licensed in life philosophy.
But tell us what's new with Shaknovich household.
Children are getting older. Similarly, difficult decisions, what schools to go to and what books to read. And the practice is very busy. We've welcomed a new associate, Dr. Roshan Abdullah, who's been a wonderful, wonderful addition to our practice. And that has made a huge difference fall and winter for whatever reason.
It's a great practice. Down at Ocean Parkway, what's the address?
It's
down all the way down at Ocean Parkway.
3049 Ocean Parkway.
You go like you're going to go on the Cyclone. Instead of making a right, you make a left and you go find Dr. Shaknovich's office. I know I've been there. It's great. So thank you.
Thank you.
And Dr. Montgomery Douglas, who's come with us on a bad night, right? Not an easy night to travel.
True.
But what's new up at New York Medical College?
We're starting a new family medicine residency program.
Oh.
The only one in the state going up for accreditation this year.
Beautiful.
So it's going to be at Open Door Family Medical Centers at Phelps Memorial Hospital and New York Medical College.
Excellent. And then you're chairing that too.
And I'm, overseeing.
Get a little bit more money?
Putting it together.
No, I'm trying. Who's ever out there, the man's doing extra work, So we're going to go right to our busy phones. I see this Arlene, interesting name. Hi, Arlene.
Hello.
Hi, where are you calling us from?
Kensington.
Kensington, not far from here. How are you doing tonight?
I got cabin fever.
Cabin fever. A lot of people getting depressed, a lot of tensions flaring. And any of your tensions flaring?
No.
No, good. Okay. What can we do for you tonight?
All right. I have a reoccurrence of a canker sore in different parts of my mouth. I've asked my dentist. He did not give me an answer. I have not asked the doctor as yet.
Okay, you were on Ask the Doctor, so we're going to ask him now. Does anybody have any magic cure for canker sores? And what are canker sores?
Are you talking about inside your mouth or on your lips?
Inside my mouth, I've used salt to help it, but it seems to disappear and come back.
Okay. Yeah, this is a very frustrating problem. It's actually, I believe it's aphthous ulcers. And we don't really know the cause. There are many theories. It could be viral, it could be stress, it could be this, it could be that. But basically we treat it symptomatically. There's Blistex, which is something you can get over the counter that has a little anesthetic in it that will help to take away the pain. As far as if it's maybe stress related, then that's something that needs to be addressed, as far as management of the stress. But we don't really know the cause. But symptomatic relief, meaning whatever you could use, like Blistex or other creams from the store, viscous lidocaine, all these are things that we can use that could take away the pain.
Any other tricks?
Yes, sometimes, I don't know if you have dentures, ill-fitting dentures can cause problems too, and also other dental problems. So I think you should also get evaluated by a dentist.
An old trick, I don't know if you guys heard of it, would take a little tetracycline, half the powder, and mix it and then put it on. Supposedly offers relief. Again, I don't say do it at home, but you might want to ask your doctor if he's heard of this thing. It was an old-time thing from the old days of medicine.
Well, I guess some of the over-the-counter products like Oral-B and stuff, they do have some antibiotics in them. Yeah, apart from lidocaine, they also have antibiotics. So you can try over-the-counter medications.
And a little yogurt, right, to restore the normal flora. Okay? Hope we've been able to help you. I think she's watching another show, got bored with the answer. Okay. Let's go to Mary. Mary.
Yes.
How are you
Dr.
tonight?
Garner.
Good. Where are you calling us from?
Staten Island.
Wow, very good. How things looking bleak out there tonight?
Oh, it's terrible.
Terrible. Yeah, this hail is supposed to be coming, ice, and who knows what.
Oh, it's a mess out there.
What can we do for you?
I have a question for the cardiologist. I was just diagnosed with ventricular tachycardia,
Okay.
and I was wondering if you could explain what it was and what the procedure is.
Sure. Dr. Shagnovich, how did they make that diagnosis? What is it?
Well, it usually is made by interpreting either your electrocardiogram or a longer recording of your heart rhythm on a 24-hour monitor or event monitor. It can be a potentially serious problem, and certainly it requires attention of a specialist. Certainly a cardiologist should evaluate your heart in terms of its structure, look for possible causes in your blood tests that may make the heart a bit more irritable. It's very, very important to get to the bottom of this, precisely because it can, in some instances, be of some consequence. And if it is truly important clinically, then there are subspecialists in cardiology who treat complex arrhythmias. They're called electrophysiologists.
Yes,
And then your cardiologist would recommend one, and they would discuss a variety of treatment options that are available, and they range from medical therapy to catheter-based therapy to device-based therapy to surgical therapy. But before you get worried, it's very important to approach something like this systematically, and so you should find a cardiologist who will become your partner in this.
Mary, very important, because this can be quite serious.
All right, thank you very much, Doctor.
Okay, give us a call back. Let us know what happened, okay?
All right, thank you,
Thanks.
Doctor.
Let's go to Mayra. Mayra?
Myra,
I knew, these guys write it down, M-A-R, how do you spell that?
M-Y-R-A.
I know, they changed it to Mayra. But anyway, I like Myra better. What do you think?
Yeah, I like Myra better, too.
Me too. Where are you calling us from?
I'm calling you from the Brownsville section of Brooklyn.
Oh, my father was out there at some time in the schools out in
Was
Brownsville.
he? Oh, okay.
And he was out at a difficult time. Remember when Ocean Hill, Brownsville, a lot of the busing issues and the
Yes,
racial tensions?
yes. Back then, yes.
Yeah, he helped to diffuse a lot of those. I know he had a lot of support in both communities. So,
Yeah.
Anyway, what can I do for you tonight?
Okay, I was supposed to have a biopsy yesterday, which was Monday the 31st. I was supposed to have a histoscopy, but my blood level is so low, it's 9. So I couldn't have the biopsy, so I went to a hematologist yesterday, and now I'm on iron, folic acid, and vitamin C. She's going to reevaluate me Monday. If my blood level isn't up Monday, then she's going to transfuse me, because she says my bleeding is not going to stop until I actually have the biopsy, because I've been bleeding, and I'm 59, and I finished with my menstrual cycle, and I'm still bleeding.
Okay, so just to recap, you have a lot of bleeding, which is causing you to become anemic. And they were going to go and do a biopsy, but they felt they couldn't do the biopsy because your count was low. And they gave you some medication to iron to bring it up. It didn't work, and they may have to transfuse you now.
Right.
So the question is?
So does that sound right?
What do you think about it? Does that sound right?
Well, usually if it's for any surgical procedure, hemoglobin above 9 is acceptable. What exactly was the biopsy? Endometrial biopsy or?
Well, the biopsy was going to be a biopsy and a histoscopy.
Okay, so it sounds like she's got you got some little polyps or something, or?
Well, the uterine wall has thickened.
Okay. Well, I guess the question was, does it sound right? It sounds right that they're working it up right, that they're not being overly aggressive. They're making sure that you're well prepared for the biopsy, that your blood tests are all in order, that your levels are all in order. I think they're doing the right thing. Everybody?
I mean, the only thing I would add would be, are you symptomatic from the bleeding? I mean, is the bleeding causing you to be dizzy, lightheaded?
It's causing me to be very weak, and I have lost my appetite.
Okay, so that means that something has to be done. So at this point, you could wait until you develop the blood count enough by taking the iron over maybe a few weeks. But the thing is, the problem is that you're bleeding faster than the iron would build up. So it would make sense to go ahead and transfuse, get the blood count up high enough that you can get the biopsy and take care of this problem. Otherwise, you could be chasing it for a while.
Yeah.
Exactly.
Dr. Shagnovich, just tell the people out there that think, do I have anemia? Do I have a low count? What are some of these signs that they may experience or may not?
They can be quite subtle, and so anytime a physician hears a patient complain of fatigue, certainly it comes to mind, and it's easily ascertained. So we get a simple blood test that tells us quite a bit about the balance between production and disappearance of red cells. And if in fact someone is tired, lightheaded, dizzy, short of breath, then of course one among the very first screen we do would be a blood count.
But thanks a lot for your call. And let us know how the biopsy works out, okay?
All right.
And let's see, I see we have Ivan is waiting patiently on line 3. Hi, Ivan.
Hi, Dr. Gardner. How are you? It's Ivan.
Ivan, you know I have a hard time with these guys. How do you spell Ivan?
I-V-A. Ivan the Terrible.
And I know, and they put a Y in front of it. Wouldn't you pronounce that Ivan if you put a Y?
Yeah, Ivan, that's like in a Spanish term they call Ivan.
Yeah. But anyway, I like it. It's a good name. Where are you calling us from?
I'm sorry about your father.
Thank you very much.
Yeah, I lost both my parents at an early age, so I know what it is.
Yeah, it seems like, you sing well. He's an old guy, and it doesn't get easier.
No. My mother died 62 of colon cancer, so I know what that's about. Doctor, I want to thank you for giving me a pain management doctor, Dr. Hediyatniev, last week.
Right, he's
and
excellent.
I got him. I went to him today. I got to go back next week. What's happening is just one quick question. I had this summer came down with MRSA. Now, I had a lump on my right side of my shoulder that I went to the doctor. They looked at it. They took it out. Now, afterwards, they gave me Bactrim in the nose and some kind of soap, Bisoderm, to cleanse with because I have irritable bowel syndrome. They were afraid to put me on an antibiotic. They said I didn't need it at the time. Well, I went on for a while. Everything was fine. And about a month ago, it came out again, another site, which they call colonization. They looked at it, they did a biopsy, and it came, a culture, and they said that it came back MRSA, positive. They gave me Bactrim, 56 pills, 800 milligrams, which, of course, with irritable bowel, I didn't know how I did it, but I did it. And everything was fine. They said it's all cleansed. I'm cleaning with a soap and a certain antibiotic medicine. All of a sudden, yesterday, I noticed in the middle of the back, another one popped up. And I'm in the search. The doctor says to me, you might have to go back on antibiotics again. Now, they say in studies that taking too much antibiotics is not good for the system because when your body really needs it, it's going to resist to it, and it's not going to help you. Is that true? And how do you keep on going back on antibiotics every time a abscess, not an abscess, but a bump or a boil comes out? Does that sound right to keep taking antibiotics?
Right. I have a good question. So a question about this methicillin resistance. So it's an antibiotic where these bacteria have become resistant to it, a typical antibiotic, mostly skin infections. We have to use other antibiotics to treat it. I'll go to the panel. What do you think? Does he need new antibiotic round?
Well, definitely, if you have MRSA growing, yes, you need to treat it. Also, what you did initially about taking care of the colonization, I don't know if you were diligent enough, with the Bactroban, because, maybe you are harboring it somewhere, and that's why you're getting these reinfections. So I think you need to go back, reculture, get a nasal swab, and reculture it, just to make sure that you don't have it in your nostrils, in the nasal mucosa, basically. But definitely, this infection has to be treated too. Even though there are complications and side effects of antibiotics, the infection has to be treated.
You mean to tell me so I might have to go back on another round of Bactrim again?
Ivan, wait, I got a second opinion. Dr. Douglas?
You will need a pill this time to wipe it out from the inside, not just the outside.
Bactrim.
Oh, you took Bactrim.
The
Okay.
Bactrim, and I took it. Everything was clean for a couple of weeks, and yesterday I noticed another a little pimple was on. I put some medicine on it, and it seems like it's going back in the skin slightly. But I went to call my doctor, and he's on a seminar. It's hard to reach. But I'm wondering, do you have to keep on, every time you see a little pimple or a little outbreak, you have to keep running and taking antibiotics again?
Well, that's the thing. It is very frustrating, you know, that you've had, this is like the third time you're having it in several weeks. And it is, I'm thinking of about a couple things. One is that, is there an abscess or is there something internal that we haven't seen yet? In other words, you could have something on the skin, but it's a reflection of what's going on systemically. So that's what needs to be a physical exam to look and see on the inside what's really going on. And number two, to step it up to a more powerful antibiotic. That's the thing I would do at this point.
More powerful than Bactrim?
Yes, definitely. We do
I
have
heard
more
Bactrim
powerful.
is one of the most powerful.
No, we have more
Bactrim is
powerful
nice
than that.
every day. It's fine. Ivan, give us a follow-up on that, but it sounds like you need to go back.
Okay, Dr. Gardner, I'm going to call your office tomorrow for a good dermatologist recommendation. Will they be able to do that for me?
We can do it. Okay.
Thank you.
Take care. Franca.
Yes, hi.
Hi,
Dr.
that's a
Gardner,
nice
how
name.
are you?
You say that Franca?
Franca.
Franca, very nice. What's the derivation of that? French?
Francesca, it's Italian.
Italian, very nice. Now,
Thank
there's a
you.
rumor out here you may know the answer to the quiz.
I hope it's correct.
Okay,
Is it Bay Ridge?
I want you to step back. No, we got to play this up a little bit, Franca, okay?
Okay.
So step back a little bit.
Okay.
Okay, Franca,
Yes.
what is the town that was known formerly as Yellowhook? And number two, why was the name changed? So what's the town first?
What was the town? Was it Bay Ridge?
You've got 1 out of 2. Now, to
Okay.
get the plaque, we need the second question.
Okay. And the answer to the second question, was it yellow fever?
Was it yellow fever? I'm going to ask the judges for their drum roll. Franca, it's amazing. I don't know how you got that so
I
quick.
got it.
But you're a grand prize winner.
Oh, great. Thank you.
What do you think about that?
That's wonderful. I'm going to have to put it right next to my husband's plaque.
Your husband got a plaque too?
Yes, he did.
You can hang it above the bed? Where are you going to hang
Yes,
it?
he kept rubbing it in. I said, I'll get one. You watch.
Very good. Isn't that amazing? It was called Yellow Hook,
Yes.
and then they had to change the name in 1853 due to the
1853, exactly. Yeah.
yellow fever scare.
In Bay Ridge, I had no clue.
And nobody would go there. So I like Yellow Hook better. What do you like, Bay Ridge or Yellow Hook?
I like Bay Ridge. I'm used to it.
Yeah. But anyway, so we're going to get that speeding right off to you.
Wonderful.
You should get it in about a week or two.
Okay.
And we're going to have it engraved, and it's beautiful plaque, handmade. You know where?
Yes.
Okay.
Italy. No.
In Japan.
In
Okay.
Japan.
But anyway, so
Great.
thanks very much for the call.
Thank you.
And we'll talk to you soon.
Okay. Have
Take
a good
care.
night.
Thank you, too. Let's go to Carol now. Hi, Carol.
Hi, I'm calling from Brooklyn.
Which part of Brooklyn?
I'm calling from Park Place.
Where's that? Which town is that?
Park Place in Brooklyn.
Oh, is that along the Bell Parkway?
It's New York.
East New York. Okay, very good.
Yeah.
What can we do for you tonight?
Okay, I'm calling, if I lie on my left side, I would get a numbness in my thigh. And I don't know what's going on there.
Okay. So we're getting tricky questions tonight. These are not easy. She's lying on her left side watching TV, and she starts getting numb in the thigh.
Okay, but wouldn't that be just the circulation, that the weight on that side?
I have no idea. It happens a lot.
It happens a lot.
Yeah,
And
and
how
it would
long-
go down to my ankles. Sometimes I would feel a tingling going down to my ankles.
Maybe her back has some.
Yeah, I think it may be.
And how long does that numbness last?
If I get up and walk for a little bit, it would go away. But once I lie on that, if I'm on my right side, it doesn't happen.
Mhm.
When I lie on the left side, it would happen.
And how long have you been having this problem?
Over a couple months now.
And is it getting worse?
Hello?
Is it getting worse?
No, it's the same way. It's the same way. So I'm kind of worried. I don't know what's going on there.
Have you brought it to the attention of your doctor?
No, I didn't.
Well, and certainly I think it's prudent. If you've had a symptom for 2 months and it obviously concerns you, it would be a good start for you to bring it to the attention of your doctor, who can do a physical examination, order screening blood tests if they're necessary. Again, it's difficult for us sitting here to deal with mystery diagnoses because we don't have the privilege of examining you, talking to you at length, or getting additional information. But generally today, we have quite a bit of technology on our side, and some of us even have a few minutes to spare. So if you give us a chance, we should be able to sort it out, but not on television, perhaps.
Carol, we got to get to the bottom of this. It's going to take...
It could be a pinched nerve, so I think you need to get to a neurologist and maybe do a EMG. There's a test called EMG, so that it'll tell us if you have a pinched nerve. Okay?
Okay, then.
Okay,
thank you. Have a good night.
Thank you, too. What we're going to do, we're going to go to a break. And before we go to the break, I just want to acknowledge 3 places that really helped out a lot in the care of my father. Lutheran Medical Center, and a fantastic facility for rehab and nursing, Silvercrest. Have you ever heard of that? It's in Jamaica. Really beautiful, under the care there of Andrea Gibbons and Mike Trottola. I just want to thank them. And the Lutheran Medical Center care. And then the support that we've gotten from New York Methodist Hospital has been amazing. So, you know, in this bad event, a lot of good things came out as well. So let's take a short break, and when we come back, we're going to talk about internal medicine, cardiology, and family medicine. And the number to call is 718-499-6101. The email is askthedoctor@netny.net. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. Welcome back to Ask the Doctor, where our topics are internal medicine, cardiology, family medicine. With me I have Dr. Kanchmala Kadapati, internal medicine attending at New York Methodist Hospital, Dr. Alexander Shaknovich, cardiology attending at New York Methodist Hospital, and Dr. Montgomery Douglas, chair of the Department of Family and Community Medicine at New York Medical College. Let's get right to your questions. I have Elsa. Hi, Elsa.
Good evening, Doctor.
Good evening, Elsa. Where are you calling us from?
I'm calling from Bayside, Queens.
Bayside, beautiful neighborhood out there, isn't it?
It's lovely, especially now with all the snow.
I detect a slight accent. Where's that?
I am from Norway.
Norway, it's very nice. Do you know in Bay Ridge, I think in Bay Ridge is one of the largest Norwegian...
Yeah, that's where I came off the boat to stay with my family there in Bay Ridge. I love Bay Ridge.
Did you know about the answer? Did you know Yellow Hook was the original?
No, I didn't know.
Interesting, right?
Very interesting.
You never know what you're going to learn on this show.
Yes, it's a beautiful show, Doctor, and I thank you so very much. I have a problem since Thanksgiving. I have been to 2 doctors, and my problem is that I had a back drip. It started with a back drip and like a little bit of a sinus thing, and it went into my ear, and all of a sudden, the end of November, I felt like my ear was completely clogged, though I could hear on it. So I went to see my regular doctor, my family doctor, and I also had a little bit of a stiff neck with it, so he gave me a muscle relaxer and something to still the pain, because it was quite painful also in the neck. Well, that went away, but in the meantime, I went to an ear specialist, and he said he did not know what was wrong with the ear, but he ordered an MRI for me to take now in January. He also had a hearing test also while I was there in the office. He had an ear test for me. And my left ear, which is affected, has less hearing than my right ear.
Okay, so what's the question, Elsa?
The question is that two doctors now doesn't know what's wrong with it, and I have a slight vibration in the eardrum with a very weak buzzing in the same ear.
Okay, so we're talking about a condition affecting the sinuses, the ear,
Yeah,
maybe
the
some
sinus-
tinnitus, maybe some ringing in the ear, some noises that you're hearing.
Well, it's not a ringing. It's a very weak buzzing-like.
Buzzing.
And a slight vibration in the eardrum, it feels like.
Okay, so let's see what our panel thinks.
Migration, she said?
Yeah. Vibrations. We're hearing
Vibration.
some buzzing and some vibrations, and
In
we don't.
both ears or one ear?
Only on the left ear.
Okay. And they said your blood pressure was fine?
My blood pressure is a little high. I'm taking a water pill.
Okay. And he couldn't tell what was the reason for the buzzing sound?
No one could take it. No one has been able. They want me to have an MRI.
Okay.
But I don't know why I should have an MRI, because it feels like my eardrum is like vibrating slightly and then a very weak buzzing sound.
Okay, so I think we got a good picture of what's going on here.
Yes. I would agree with the idea for the MRI. What happens is that sometimes we get an imbalance in our ear, either the hearing or the balance. Both of them, as you know, they're handled in the inner ear. And so what you did was the right thing. You went to the doctor. They checked. I'm sure they checked the nerves, your nervous system as far as coming from the ear. And they now want to check and see if there's anything what they call central, something internal.
Yes.
And that's a reasonable test to do.
Okay.
Now, I'll have to tell you that ringing in the ear is very common in older patients.
It's a buzzing.
It's a buzzing. It's a buzzing.
Buzzing, but you call it buzzing, but it's very common in older patients. So it doesn't mean because they ask you to get the MRI that it's necessarily a problem.
No.
But I think you should get the MRI. At your age, starting having buzzing and new onset buzzing at your age.
I think we want to rule out something more serious.
Exactly.
Yes, exactly. That's what I was going to add. There are certain conditions, benign, but there's something called acoustic neuroma. So something like that, they want to rule it out. So it's good for you to go have the test, as long as you're not claustrophobic. That way you know whether you have something serious or not.
But also,
the loss of hearing and the buzzing in the ear, sometimes they can mean something serious, and that's the reason why they ordered the MRI.
Elsa, it sounds like get it worked, get it checked out.
Yeah,
Give us a call
can I
back.
ask another question, please?
I got to move on because
Okay, thank you very
It's
much.
a quick question. I hate to give me one quick question.
Yeah, the other question is that I remain ice cold in my face after I have been outside or if I get up in the morning. And my nose is ice cold, my cheeks are ice cold, yet I have very warm hands and feet, and the rest of my body is very warm. And I cannot, it's something that started this winter, and I cannot figure out what causes it. It's very uncomfortable.
Okay, also, let's listen to them. I'm going to ask Dr. Shackner. It's not his area, but I want him to come up with a plausible, why does the face get cold and not the hands?
My favorite answer is I do not know.
Are you wearing gloves?
Yeah, exactly. I was going to say that.
But
Probably that's
very
the exposed
important
part.
not to worry. This is not at all a harbinger of any serious illness.
No.
And the fact that we cannot come up with a specific answer simply means that this problem generally is relatively benign, and you ought to be able to take ordinary measures, ordinary steps to avoid exposure and hopefully spare yourself unnecessary distress.
Thanks,
but
Elsa.
it's not serious.
Good news on both questions.
Thank you very much, Doctor.
Be well.
Bye-bye.
Give us a follow-up. Hi, Rocco.
Yes.
Rocco, how you doing? Where are you calling us from?
Whitestone, New York.
Whitestone. Do they still have that? Was there an amusement park out there?
What?
Remember there used to be a little amusement park and drive-in movie?
Driving? No. I am by the Trucks Neck Bridge.
Oh, okay. There used to be an amusement park and a drive-in. Anybody here ever go to a drive-in movie?
Well, I moved here just a few years ago.
Oh, I think it's gone, the movie. But
Yeah, movie, it's gone. It's a long time ago.
Long time. Where are you from?
Originally it's from Italy, but I came here in 1955. That's 55
You like it? Which you like better, Italy or here?
Well, I like here better.
Yeah, it's nice.
Yes.
Okay, what can we do for you?
Yes, I'm 75 years old, and about 9 years ago, I had a little blood in my stool, and so I asked my family doctor, and he sent me to the gastroenterologist. You know. Okay. So after they did the colonoscopy, so they found out that I had inflammation of the colon, colitis. So he gave me the medication, Asacol, 400 milligram, and folic acid, 1 milligram. So in the beginning, I used to take 6 every day. Now I take 4.
Okay.
And in the beginning was the first couple of years was every year, you know, to go for the colonoscopy. So my question was, now I go every 2 years. Is that the time? I mean, it's too often, or is the right time?
The question is, 75 years old. Does he, number one, does he need colonoscopy? Number two, if he does need them, how often should he be going?
Yes.
Well, because you have the colitis,
yes,
that's why you go in so often. Normally, colonoscopy for people, you know, for people or adults, you know, above the age of 50 would be once every 10 years.
Yeah.
But because you have the colonoscopy, the colitis, then you're getting it more often.
Oh, so
I think at this point, since I assume you're not having blood in your stool.
No, never. Since the first time, no.
So they're gradually spreading it out, basically. It used to be 1 year, now it's 2 years. I'm sure it's going to spread it out even more.
Yeah. Rocco, thanks a lot for the call.
Okay.
Be well. We go to Barbara. Hi, Barbara.
Hello.
Hi, Barbara. Where are you calling us from?
Bay Ridge.
Bay Ridge, from Yellowhook. Remember, you right?
No, Bay Ridge.
No, but you don't watch the show. Are you watching from the beginning of the show?
Oh no, I didn't actually.
I'm going to have to write you up next time.
I'm sorry.
Okay, well, this time we'll let it go.
Okay, very good.
What can we do for you?
I have a question about my thinning hair. Well, it's more like hair loss.
Okay, so I'm going to open that to the panel. Thinning hair in a woman. How old are you?
In my 30s.
It's a young woman in her 30s.
So, how long have you had this problem?
I guess it started maybe in my late 20s, but now it's just getting really bad.
I mean, was it related to a pregnancy, childbirth? Did it start after that?
No, I've always had a fair amount of hair. I don't know what it is that it could be, or it's kind of scary now because I notice it myself. So I don't know.
Well, there are several reasons you can look into. You know, hormonal imbalance is a big issue in women. You can check your thyroid levels, even like estrogen levels. That's why, you know, with childbirth sometimes you have hair loss. Or if you're on birth control pills, you can have hair loss. One of the new things is also vitamin D levels. If you want to check your vitamin D level, that cause a lot of problems, but that is also one of the symptoms. Or if you're using hair products, like perming products or things like that might, or like tight hairstyles that might be damaging. And if all of these are ruled out, then I guess you should see a dermatologist who will actually count how much hair you're losing and, you know, evaluate your scalp to see if you have any scalp disease.
So any other comments? I mean, I think it sounds like you need a good physical exam, make sure nothing's serious going on, and then try some of the treatments that are available now.
Okay, very good.
Great to hear from you.
Thank you. Bye-bye.
Bye. And now we're going to go to a few email questions. We'll do them quickly. Elaine in College Point was diagnosed with Sjogren's syndrome a few years ago. Causes dry mouth, eyes are dry, and it's driving her crazy. She's trying candy, drinking a lot of liquids, chewing gum all day long, biotin products, and she can't deal with it. It's dryness. How about a 30-second answer?
I'm really sorry about this thing, Elaine. This Sjogren is a very frustrating problem. Basically, loss of body mucus, basically mucus in the eyes, mucus in the nose, mucus in the mouth, and what we don't have a cure for it, unfortunately. What we do is just supplement it, like you use tears, you know, artificial tears for the eyes. You know, we use the biotin, which is like a salivary saliva, artificial saliva kind of thing. And that's what we do. The good thing is that it's not necessarily dangerous. It's just a very bad nuisance. It does put you at increased risk for certain diseases, so you do need very regular checkups from your family doctor. But unfortunately, we don't have a cure.
Thanks very much. We'll do now another rapid fire from Lucy. Hi, Dr. Garner. I'm 60 years old with scoliosis. She has a pinched nerve in the fifth vertebra. To reduce the inflammation and pain, she's been prescribed prednisone, Percocet, strong stuff, for 10 days. Mm-hmm. Is this the most effective treatment? Would good acupuncture, would acupuncture be any good? And she's thanking you in advance for your comments. I've heard a lot. I've learned a lot from watching your program. So Lucy, with back pain, Percocet and prednisone, what do you think?
Well, acupuncture definitely is a good option. Prednisone, as long as it's short term, you can use prednisone. And I guess seeing a good pain management person, I guess Dr. Garner will give the
Dr. Hedonotny.
Hedonotny, yeah. So, because they can do some local injections, so you won't have as many side effects as you would with prednisone or other medications. So if they do local injections, it gives relief for like 2 to 3 months. So that would be another option.
Now we're going to have a question, the last of these rapid fire, from Alex for Alex, Dr. Shagnovich, wanting to know, and he lives in Crown Heights, intermittently my heart skips a beat. What are the causes? 4 years ago he was treated for deep venous thrombosis, DVT, in his right leg. I was wondering if this may have triggered the skip beats. Thanks for your help. Your program is very informative. Alex.
The list of potential causes is long. The most common have to do with structural changes in our hearts that are related to our age, high blood pressure, heart attacks. Medications can do it, alcohol can do it, stress can do it.
Can love do it?
Love can do it.
Coffee?
Coffee, a number of different things. Again, my approach is if it's a chronic problem, get a partner. Acute problem, go to your regular doctor. That person will try to solve it. If it's acute and simple, it'll be solved. If it's acute and complex, you need a specialist. If you've had anything at all, any symptom at all, for any length of time, you need to find someone who will be your partner until this problem is solved to your satisfaction.
Very good. Let's go around back to our busy lines. We have Susan. Hi, Susan.
Hi.
Which neighborhood are you from?
I'm from Park Slope.
Not far from here. They really don't clean too well here around the snow, huh?
They clean for me, though.
Oh, why?
Because I'm in a wheelchair, so they make sure they don't want to hear me screaming, so they really shovel.
Very good. Do you ever get out into the restaurants in Park Slope?
Oh, yeah, all the time.
You like Okinawa? Have you tried that, Okinawas?
Oh, no, I didn't try Okinawa.
You're going to love this place. 7th Avenue, 9th Street, or 8th Street. The best Greek food in Park Slope.
Oh, that's new, isn't it?
It's brand new. Now it's beginning to catch on. Last night I had a hard time getting a table.
Oh, I'll have to try. Is it handicap accessible?
Yes, definitely.
Oh, I love it. I like La Villa. That's my favorite.
La Villa. I never went. Any of you guys ever know? La Villa.
Oh, La Villa's fabulous.
I'll have to give it a try. Very good. What can we do for you?
All right. Well, one is a big problem, okay? I'm in a wheelchair, but a manual one. I have rheumatoid arthritis.
Okay.
And I've had cancer at one time where I received radiation and got a hysterectomy.
Okay.
So the problem is that for quite a few years now, maybe my cancer's been gone for about 8 years, I've always had trouble with my bowels. It was always like, you can just say one and I have to run to the bathroom. Now, I've had an infection on my buttocks about a month ago. I see a doctor from Methodist Hospital, Dr. Bowen, and he gave me an antibiotic, which was really good. It worked. But for about, maybe it was 2 months ago, for the past 2 months.
Are you listening to your TV?
Who, me? No.
Okay,
no,
someone
just
else.
Catching my breath. For the past 2 months, I've had terrible diarrhea with mucus in it. And it depends now. If I drink something warm, I'm okay. If I have something cold or fatty, I have to run to the bathroom within a second. And I don't know what's going on. It's just so uncomfortable. And I have to go to the bathroom at least diarrhea about 8 times a day.
Okay, so let's get try and sum up what I've got. I've got a thing written down here. Rheumatoid arthritis, have been treated for cancer,
With radiation down.
Right, had radiation, now has this diarrhea, this colitis, where she has to put the wheelchair into overdrive to get to the bathroom.
No, I don't have colitis. I don't know what I have.
Well, you have mucus and so on. So
she also got treated for a UTI.
For UTI with a lot of medication.
Well, one antibiotic.
So let's see if Dr. Karapati in 30 seconds can give that answer.
Well, because you had the recent treatment with antibiotic, one of the things, you got to look into colitis, what we call Clostridium difficile. So it's a simple, if you bring in a stool sample, send it to the lab and test for that.
Oh.
Yeah, so I think you should get that checked. Oh, and there are other, if that's not the reason, then you might want to see a gastroenterologist and have them look into the colon. There are other entities in older people where you have, collagenous colitis, different kinds of colitis, and other reasons that you got to look into. But something easy to treat and easy to diagnose would be this Clostridium difficile colitis. So
Great.
just check that out.
Okay.
Thanks.
The only thing that I want to ask you is, and I'm not afraid to get one of those colonoscopy, but I'm worried about the stuff that you have to take to clean out your bowel. There's no way that I can make it to the bathroom because I don't have good bowel power since I had that radiation. I've had quite a few accidents, and I dread taking that. So how can I have a colonoscopy without having that stringent stuff?
Well, that's something that, is going to have to be a trade-off. You do the best you can and then have the doctor pick it up. Thanks a lot. Feel better. Give us a follow-up, okay? Let us know about Okinawas. Take care. Hi, Marlena. Marlena. Is it Marlena or Marlena?
Hi, Dr. Garner. My condolences to you.
Thank you very much. Where are you calling us from?
I'm calling from Bensonhurst, Brooklyn.
Benson, and would you call it Marlena or Marlena?
Marlena.
Marlena's nice. I like that.
Thank you.
Where is it from?
That's from Italy.
Very nice, Marlena.
Yes, thank you.
So, and Bensonhurst, what do you like out there? You like that?
Well, I know that question will come up, and I was thinking about Casa Calamari at 18th Avenue in Bath.
Oh, interesting. What's the name of it?
Casa?
Casa?
Like the house in Italian. Calamari, like calamari squid,
Interesting. It's just sit down?
Yeah, and that's the best calamari I ever eaten in my life because they're really soft, and I asked for the recipe, the secret, and they won't tell me.
Oh, there's a secret there.
There's a secret there because I tried to duplicate, and it doesn't come out that way. And I speak Italian. I try to bribe them. No, we don't tell you.
Very nice. What's the name of the guy there that seats you?
Oh, boy, there's a guy named Gino, and there's a couple of partners. They're all Italian. They even offer me a job.
Gino, we're going to have to go by there and take a look at that, okay?
Yes, yeah, they have a brick oven pizza also. Very good, but very expensive. The brick oven pizza.
You ever go to Spumoni Gardens for ices afterwards?
Yes, I've been to Spumoni in the
Great
summer.
place. You've never
Yes,
been there?
right, I've been there.
Isn't that the best ices?
Yes. I'm not too much a fan of that, but I like the outside garden.
You sit outside, nice hot summer's night.
Yeah, outside and
for a little romance.
very nice. Yes.
What can we do for you, Marlena?
Okay, Dr. Garner. The last couple of weeks I have been itching, especially at night, a lot of itch, and I look at myself in the mirror. I see blotches. I see little pimples. They don't stay long. They move quickly away, and they're all over the place, from the foot to the neck to the back to the front.
Okay,
so, and I'm a little bit nauseous since this happened. I noticed that I'm a little nauseous in the morning or whatever.
Okay, so Marlena's scratching all over the place. She goes to look. There's welts, there's pimples, there's scratches.
Yes.
Blotches too.
Blotches, everything is there.
Little pimples, and they disappear within a second.
Okay, let's see.
Molina, did that? Have you changed? Are you eating anything different? Are you been exposed to anything different, like new detergent or?
No. Basically, I thought it was like an allergy because of the dust. I've been careful dusting everything around me, and pretty much cooking in the house. I don't really eat fatty food or spicy. I don't know what it comes from. It's very frustrating.
What? I'm really sorry you're having this problem, first of all. But the thing it sounds like is that you do need a physical exam.
Yeah.
Because what you're saying is that in addition to the itching, you
Yes.
also have a nausea.
Yeah, do I have a little nausea? I'm taking pills.
Yeah, but the nausea is new. The nausea is new.
Yeah, the nausea is new. It's pretty much a current thing with me.
Oh, it's a common thing with you. Okay.
Yeah, right.
So,
Dr. Katapati has a disgusting thought.
Yeah, I think also one of the new issues in New York is bed bugs. So I think you would want to get your house checked.
Yeah,
you
I
know.
thought about that. I was checking my bed, my mattress, change the sheet every couple of days. But I did a lot of checking around, for that reason, and nothing seems to work. I mean,
It seems like we got to, don't forget the hot weather, the cold weather, the heat makes the atmosphere very dry.
I've been putting a lot of cream on my skin.
You put
People
cream
say
on.
People even say stress.
You need maybe stress. I think you need to see a dermatologist for this because it's going to keep going and going and going. It's going to be harder to treat.
Yeah, because I'm kind of scratching all over like people ask if I had a cat.
Marlene, I want you to give us a call back next week. If you need a referral, we'll give you a referral. Let us know the saga, how it's going on.
You recommend to see a dermatologist?
well, you could actually see your own doctor, actually.
Yeah, my own doctor. I'm supposed to go there soon.
I think that's a good idea. What it sounds like to me is something called urticaria, actually. It's like an internal allergy.
Yes.
And that's something where they need to do a physical exam, and if that's what they think it is, then it needs some blood testing and urine testing, yes.
Okay.
Good point. Good. I think a regular doctor will take care of that
Very
fine.
good. Thank you very much, doctor.
Thanks, Marlena. We're getting these problems tonight. I don't know. Is it Pat?
Yes.
Pat, hi. Where you calling us from?
Foxlope.
Oh, not far from here. Have you ever called before?
Yes.
Okay, good. So you're not. And what do you think of Okinawas?
I don't know. I like Embers in Bay Ridge.
What's the name of it? Embers?
I'm a steak guy.
Oh, so you like steak. You got to go into Embers, yeah. Not bad, not bad. What about that Geno's?
You remember me. I used to call back then. My nephew was the one who got hurt in the diving accident.
Oh, with the paraplegic? How's he doing? I remember Pat. I think he hit the wrong... Pat, call back, because I like talking to you, okay? Okay, let's move on to the next call. It looks like it's an email question. From Linda. Good evening, doctors. I have hypothyroidism and take levothyroxine daily. Can I heal this naturally? Alex, what is naturally? What is this? What's unnatural? I don't know.
To my knowledge, if your my colleagues will answer this in a much more nuanced way, but if your thyroid gland is not producing enough of the thyroid hormone, it needs to be supplemented or replaced with a pill.
Dr. Katapani, if she comes into your office, what are you going to do for her?
Well, I mean, if she needed supplements, that's because she's deficient in thyroid. So, yeah, I would recommend supplements, not natural.
Go with the, stick with what your doctor's giving, unless, I don't know how you're doing, you didn't let us know, but hopefully you're doing well. Yeah. Okay, we're going to go to one more from Midwood. Marilyn in Midwood wants to know, I have high blood pressure, cholesterol, and thyroid problems. I see an internist. Do you believe I should be seeing a cardiologist? Am I seeing the right person? So this woman comes in with some heart problems and so on. Should she be seeing the internist, or should she be seeing the cardiologist or the family doctor? That's a tough one. What do you think?
Depends on whom you ask first.
Yeah, exactly.
The thing is, everybody should have a family doctor, in my view, because it's a doctor that specializes in you. So.
Okay.
Yeah, and then the doctor will determine if you need to see a cardiologist.
Exactly.
I think that's fine.
I'm going to try and do really rapid fire because we've got 4 questions we're going to get in 2 minutes. Cheryl?
Yes.
Hi, Shirley or Cheryl?
Shirley.
Shirley, I like that. Yeah. Where are you calling us from?
Midwood.
Midwood. What can we do? Let's hear the question.
Stomach problems, chronic diarrhea and constipation. I've been to gastroenterologist, can't do anything about it. When I was in the hospital for surgery and in rehab afterwards, my stomach was fine.
Okay.
And now that I'm home again, it's starting in again.
You've had this problem for a long time, or is that recent?
Yeah, off and on. It's chronic.
Chronic. Is it irritable bowel syndrome, they call it?
Probably, yeah.
That's a frustrating problem.
Tough one.
We treat the diarrhea with antidiarrheal medication. We treat the constipation with anti-constipation medication. It's very hard to catch the balance. Sometimes we use Metamucil, which is like
I tried Metamucil, Miralax, Miralax,
stress
everything. He
management.
sent me for X-rays of my abdomen. It was full of feces.
It's a tough one. It's a tough one. I got to move on, though. I got to move on because the last caller tonight is Teresia.
Like Dr. Alex said, having a relationship with a physician so that they can help you partner and work with you with this chronic problem. That's what it is.
Teresa?
Yes, hi.
Teresa, I'm sorry to rush you, but what's the question?
Yes, I have a problem. I have to see my doctor in 2 weeks, but I have a problem that every morning when I wake up, like I hear my heartbeat in my ear, and it lasts about 10 minutes or so.
Okay, Dr. Shagnovich hearing a heartbeat in her ear. That's a problem.
Your blood pressure may be a little higher in the morning, not uncommon. I ask my patients to go through the exercise of recording their blood pressure multiple times a day. I always tell them that they shouldn't worry about the actual number. They should just write it down and bring it to the attention of their doctor. And if your blood pressure is higher in the morning, it's relatively simple to adjust your medication so that it is brought down to a more normal level. And if that does not help, then of course we can look into more unusual and potentially important issues. But I would start with your blood pressure.
Thank you. And let's move to the last caller tonight, Pat.
Hi, Dr. Garner.
Pat, we got disconnected. I have to ask you to call back next week. How is your nephew doing?
He's doing good. He's getting a map.
I haven't heard from you in a long time. Please call back next week.
I'll call back next week. Tuesday?
Tuesday night, 8 o'clock.
It's every week, right?
Every week.
Thanks, Doc.
Take care. That was a quick show, but that was an unusual show. We got a lot of questions you don't usually ask in the office, which is you never know what's coming in here. So anyway, we've got to move out of here because the next show is waiting to come in. So I want to thank our doctors, Dr. Karapati, Dr. Shagnovich, Dr. Montgomery Douglas. We hope we were able to help you. Now, it's good to remember you should always be proactive about your own health. Speak to your doctors about your concerns. Go for second or even third opinions. In the meantime, visit our website at netny.net/askthedoctor. Have you ever been there? It's a nice little website. You can read there the tablet column, podcasts, the forum. You send in your quiz questions there, and much more. And you can also watch last week's episode tonight at 10. So what are you going to do at 10 o'clock? Last week's episode. Then you can, thanks to our quizmaster for the yellow hook question, Dr. Linda Lapatosa. And I want to thank you for all your questions. Now next week at 8 o'clock on Tuesday, we're going to be discussing lung disease, cardiology, and orthopedic medicine. I want to say good night, have a great week, and I'll see you in the tablet.